a child's silent pain. Imagine a child struggling to swallow, crying in pain, unable to eat or sleep. Tonsillitis is a common yet painful condition affecting millions of children. In some cases, it can lead to serious complications if left untreated. I'm Dr. Joshua Dirito, a family physician. I have interest in public health and cancer prevention and treatment. In this video, we are going to look at tonsillitis in children, the symptoms, and when to seek medical help. Tonsillitis, the numbers. Over 50% of children experience tonsillitis by the age of 5 years. 70% of the cases of tonsillitis are usually by viral infection, while 30% are caused by bacterial infections. More than 600,000 tonsillectomies are done worldwide because of tonsil infections. So, recurrent tonsillitis is a major cause of school absenteeism and can be easily prevented. So, what is tonsillitis? Tonsillitis is inflammation of the tonsils due to viral or bacterial infection. So, what are tonsils? Tonsils are a group of two glands found at the back of the tongue on the upper part of the back of the throat. So they cause sore throat, they can cause fever, and they can cause difficult swallowing. They can be recurrent, like after every 3 months, and can affect a child's health and well-being if not taken care of adequately. So what are the symptoms of tonsillitis? These are the signs and the symptoms that you need to watch for. 1. Severe throat pain. 2. Fever, usually more than 38 degrees centigrade. Then we have swollen red tonsils with white patches. This, if you tell the child to open his or her mouth and you look at the back with the tongue on the lower side, you can see the tonsils. There are two small swellings on the lateral sides of the back of the throat. Then they will have painful swallowing. Sometimes they may have drooling of saliva, especially for the small children. And they may also have bad breath because of the infection and the foul smell from the tonsils. If this persists, seek medical care. So what are some of the complications of untreated tonsillitis? Some of the potential risks of untreated tonsillitis include they can form abscesses around the tonsil region. This is a serious infection and sometimes can require drainage of the pus for treatment. Then obstructive sleep apnea. Obstructive sleep apnea is a child having difficulties when in breathing when asleep. This is because, especially because of the swelling of the tonsils, lowering the back of the throat, narrowing the back of the throat and making it difficult for the passage of air, especially when the tongue falls back. And this can have disturbed sleep in children, and also can lead to poor feeding and also irritability. Then there is a serious condition which is a consequence of throat infection by a bacteria we call streptococcal pneumonia. If this bacteria is not well treated, then the infection of the throat can spread to the heart valves, leading to complications of heart diseases in small children. And this happens around the age of 3 to 5 years, and then the kids develop what we call rheumatic fever, manifesting with the symptoms of heart failure, and this can lead to serious complications. And if these infections are also not well treated, can also lead to complications of the streptococcal infection to the kidneys. Sometimes this can prevent with a rash, and these are conditions which sometimes can be life-threatening. So it is important to seek timely care to prevent these severe complications. So when do you need to seek care when your child has tonsillitis? 1. Go to the doctor or your healthcare provider if your child has difficulty breathing or swallowing. 2. If your child has persistent fever for more than 3 days. 3. If your child has repeated episodes of tonsil infection more than 5 times in a year. Because this recurrence of the infection is what leads to complications in the heart, what we call rheumatic heart fever, or you can have complications in the kidney, what we call glomerulonephritis. So early care prevents complications like abscesses and also sleep apnea and also these kidney and heart complications of tonsil infection. So what are the treatment options available for tonsillitis? 1. How do you manage tonsillitis? The first thing is relieving the pain and the fever. So how do you do that? Keep your child well hydrated. Make sure your child is feeding adequately. If the child is breastfeeding, ensure that the child is well breastfed and is taking adequate meals. Then use painkillers like paracetamol or brufen to prevent the fever and the pain. Then give the child soft food that he can be able to handle with the swelling and the pain. Then, of course, if you suspect there is a bacterial infection, then it is important to use an antibiotic. And when an antibiotic is prescribed, always make sure that you take it at the right time, at the right dose, and take the complete dose. If the tonsillitis is recurrent, then there could be need for surgery. So consult with your health provider. So how do you prevent tonsillitis? Keep your child healthy. Encourage hard washing to prevent an infection, especially before a child feeds, after a child uses a toilet, when children come from school, before they eat at school, they should learn to wash their hands. This is a simple way, but it keeps many infections away. Avoid sharing utensils with sick individuals. If a child has tonsillitis, then at home it is good that if you have other children, they avoid sharing the same utensils together, because this will spread the infection. And if a child has a tonsil infection, let him or her stay at home until the infection is well controlled for like 3 days, and then he can continue with his schooling so that he does not spread the infection to the other children. Then sharing, especially things like sweets in children, should be highly discouraged. I know this is a tall order, but let's do our best so that we avoid some of this spread of infection. Then strengthen your child's immunity by ensuring adequate breastfeeding, adequate hydration, and adequate nutrition for your child. A healthy child is a happy child. So what do we need to do to prevent and take care of tonsillitis? 1 is be aware of the symptoms of tonsillitis. 2, seek medical attention, and then implement the necessary first aid at home of relieving pain, making sure the child is feeding adequately by breastfeeding and soft foods, and educate other parents about prevention. Health is not an individual's undertaking. It is a community undertaking. We all have a responsibility. So let's run together. So if you like this video and you like this information, share it with someone whom you care about, that will prevent childhood tonsillitis. Together, we can protect our children's health and live a better health. So thank you for listening. Remember to subscribe, remember to share, and for individualized care, you can call the number on the screen for your personalized care. Thank you for watching.